Good morning, I'm Amy Lynn. Cancer, I mean, it is so scary to think about, but information is key. And here to talk about esophageal cancer is Dr. Mark Bloomston from South Florida Surgical Oncology. Good morning.
Good morning, thank you.
I honestly didn't even know about esophageal cancer, doctor. There's just so many different areas of the body that can be affected. Is this a common type of cancer?
It is actually quite rare. Only about 20,000 people in America will get esophageal cancer, but it's becoming more and more common in incidence, particularly over the last 20 years.
So what are some of the signs that you may have this?
Well, our esophagus is essentially a tube that goes from the back of our mouths down to our stomach. So you can imagine a tumor that invades that tube could obstruct swallowing. So that's the most common symptom, is people get the sensation of food having a hard time going down.
Okay, so like they're eating something and they're feeling like it's getting stuck on the way down.
Exactly, and it's something that gets progressively worse over time.
So what are the biggest risk factors for getting esophageal cancer?
Well, the most common type of esophageal cancer in America is something called adenocarcinoma, which tends to arise at the bottom part of the esophagus, and it's usually a result of severe reflux disease. So people who have gastroesophageal reflux disease, or GERD, are at higher risk for developing it.
GERD, I just heard that. That's all about the way that you eat foods and don't drink anything until after you eat your foods type of thing, right?
Well, you can imagine that anything that causes you to have that reflux, so that may be body habitus, so obesity is a strong risk factor, alcohol consumption, of course cigarette smoking is always a part of that as well.
So what's the treatment for esophageal cancer?
Well, surgery is the key to this. It's actually a quite large surgery, and it's one that's difficult to recover from, but we expect 100% recovery from it.
Wow.
But the cancer can be quite aggressive, so we know that chemotherapy and radiation help make surgery better to improve the chances of cure, but cures are possible.
So basically, like any other cancer, you want to make sure that you get on this as quickly as possible, find it as soon as possible, and start the treatment as soon as possible.
Of course, early detection is the key, so recognizing that symptoms are developing, particularly patients who are at risk for developing this with severe reflux disease, maybe they've already had some damage from the reflux disease, they need to follow very closely with their gastroenterologist, get intermittent scopes to see what's going on and try to pick it up as early as possible.
And doctor, where can we go to get more information on this?
Well, certainly you can come to our website at southfloridasurgicaloncology.com. Also, the Regional Cancer Center here in Fort Myers has great information on this.
Thank you so much for coming in this morning.
My pleasure. Thanks for having me.
It's like you learn something new every day, and I love to share that information with everybody.
Great, thank you.
If you want to find out more, you can go to our website. It's fox4morningblend.com.